Good afternoon. This is Harpreet Kaur. Today, we're gonna discuss our journal 10, and I'm very excited. This is our last journal, and after that, we are done for this class. And yeah, so my first question was like, what goal did you set for yourself at the beginning of the semester? Did you met this? Yes. So this semester was a little different than the previous one, because this semester we have to see pediatric and adolescent patients. That was the goal, and yes, we met that goal. I saw the adolescents and children in the practice. So it's little different than the adults. Usually I work adults, and I also work with children, but not that closely. So we deal with their parents, we deal with them, and help them. So yeah, so my first goal was met. I was happy to see the adolescents and the children. So it was great experience with my preceptor. And second was, what feelings and present basis did you experience during your clinical experience? How did you manage them? Yeah, so as I said, like it was little different and great experience. So I'm working as a nurse practitioner, medical nurse practitioner in psych facility. So I'm dealing with children and adult both. So it was little that experience make little easier for me. Otherwise, as RN, I didn't work with children, but as now like from 2 years, it's been 2 years I'm working as a nurse practitioner. And the experience which I was taking in a psych facility, like as NP, either I'm medical provider, but I know that what's going on, what's their diagnosis, what's their symptoms. So it also helped me to deal with the kids. And interesting thing was like, in the facility we rarely dealing with the parents, but this time we'll literally deal with the parents. We call them, we ask them if they have any questions, excuse me, and we tell them like about the medication, so to the kids and the parents for everything. So we in this semester the parents are more involved, and I learn more about these things, how we can handle parents and how we can involve parents as well as children. Sometimes children don't want to involve the parents, but according to their age we need to involve the parents. So we I learned these things in this semester. And how did you manage your anxiety, self-doubt, and or uncertainty? So yes, definitely it's little different. The psych provider or psych specialty is little different than the medical. We go with the words in the medical provider. So whatever the parents are saying, the patient is saying, we agree with that. If they are saying us like they have chest pain, we are agree with that. Okay, you have chest pain. But in this psych, we have to just make sure everything, like what what the patient is saying to us, like is manipulating or is real. So yeah, I learned this thing a lot in this psych, as a learning as a psych student from my preceptor. So yeah, I was little anxious too to deal with the parents, like for everything we have to call, we have to tell them okay what's going on, explain in better way. So yes, anxious, but my preceptor was so nice, and and the professor was so nice, so I get help from them, so it helps me to manage my anxiety as well as to learning new skills from them. What understanding or insight did you develop during your clinical experience? So yes, so as a student, every day is new day, so we learn a lot. We learn every day, we learn a lot. Either is like diagnosis, either is like symptoms, it's medications. So I learn a lot, and many things coming in the market, so that was the good thing. Sometimes like I was learning from my preceptors, some medications are like come in the form of injections. So for example, if the patient is non-compliant or patient is not taking wanna not take any medications every day, so they just researching more on the injections that is weekly. So it's very interesting. So I was trying to do some continuing educations with these kind of things, so I can up to date my knowledge, what's going on, what's coming in the market, and what is their results. So it's really interesting. So has the reflective practice impacted you as a person, student, or provider? If so, how? So yeah, that's the same thing, like um, uh, practice literally impacted as a student or as a provider too. So we deal with the parents and deal with kids. With kids is little hard to know. Sometimes kids are not explain you very well how they feel or how they are doing, so it was little hard to explain them and to ask them. So that's what I feel. I think the psychotherapy is really helpful for pediatric patients. I highly recommend, or I learned that like with the um, psychotherapy, they knows what's going on and how they have to deal. So yes, it was little different experience, but it's really good. So I learned a lot during this during this clinical. And will you continue to use reflection in your future practice? If so, why and how? So yes, so I think if we have to grow, we have to learn every day. So I'm a person who always want to grow more, to learn more. This profession is my passion, so I want to help them. So that's why I come to the as a medical provider. When I saw that the same patient needs same equally need the mental health, so that's why I switched to, because I work as the ER nurse practitioner. When I saw patients coming, and because they don't have medications, and they are not finding any provider to get the medication. So it was it's so shockable, like, oh really, you don't get the provider for medication? So then I realized they literally needs more provider inside. So I always want to learn. For example, I tell you like there are many things coming in the market, so I want to learn the result, what's coming on, what is their effect and what is their side effects. So what is easier for patients, and they can get it. For example, if they was saying some injection come in the market which they have to use weekly, so that's mean they don't have to to take the medicine every day. And I saw, like, in the hospital as well as in the outpatient, especially psych patient came because they are not compliant with the medication. So it's gonna be easier for them, like, come to the clinic, get your weekly injection, and 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 get medicated so they can help. So it's really helpful. So I always gonna learn what's going on, what's coming in the market, what are their results. Same like Ozempic, for example. So Ozempic is literally doing good in the market. So patients, we know that we research on that. So same like in the psych medication, I wanna learn more about these things if I have practice, so I can help patient as much as I can. But thank you so much, Professor Dr. Smith, Tara Smith. It's really great semester, and it was really good experience to work with pediatric patients. Thank you for everything.